Our laws, as it pertains to substances, are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say. Hey everyone, welcome, and I want to get right to my special guest because we're very fortunate to have her today. It is Dr. Tiffany Moon from the Real Housewives of Dallas. You can follow her at Tiffany Moon MD, Moon like not the satellite, not the planet, the moon that circles the Earth. Also, her Instagram is /Tiffany Moon MD, and also TikTok, Tiffany Moon MD. She is, in addition to being an anesthesiologist, a mom of twins. Unbelievable, Tiffany. That's the most difficult thing you're doing, I suspect.
Yes, it is very difficult being a mother. It is the hardest job in the world.
We are very sympathetic.
Amen.
Yeah, there's Susan, my wife. We are very sympathetic to multiple parents because we had triplets.
Oh my gosh!
Not to try and one up you or anything, but we know what you go through.
We know what it's. Yeah,
two is a lot.
Yeah,
let's just put it that way.
At least you're man to man. We were always in zone defense, and it was quite a thing. Interestingly, back in those days when they had super multiples, our kids are 29 now. The high risk obstetrics sat us down and said, "Don't do this," because here's literature on mental health outcomes, reduced to twins. They were actively advising us to reduce, and we just couldn't do it. And I've told people before, I felt like a poker player taking all my chips and just going, "We're just all in. We're just all in as a parent now. That's it. That is our new world order is parents." And that's what we did for 18 years.
Well, we're still doing it.
They're still doing it in some fashion.
They're 29.
Yeah, don't think it ever. Yeah, don't think it ever really ends. I'm sorry, Tiffany.
Well, you guys might have gone all in,
us,
but I feel like you hit the jackpot.
Yeah, there you go.
Yeah,
yeah.
We're the luckiest people in the world.
Turned out I won the hand. Thank you. Yes, I was all in on the flop. And,
but we can't get them to move out of our house. Can you help us with that? That would be nice.
So Tiffany is an anesthesiologist, and I want to get into all aspects of your career in just a second, but you have a very important announcement to make. You want to get into that right now?
Yeah. 2021 was such a toxic year for me, as it was for many, for a multitude of reasons. And I decided that in the year 2022, it was going to be my year of yay. And I would only do things for myself and my family and my career that truly sparked joy. Because for so long, I said yes to so many things that I really wasn't passionate about, but I have a hard time saying no. And so the announcement that I have to make is that I am now trying my hand at stand-up comedy.
Wow.
I did one set.
That's quite a pivot.
Yeah, from putting people to sleep to actually being on stage and making them laugh, it's very diametrically opposite.
I guess it depends on what kind of anesthesia you're doing. If you're doing twilight anesthesia, you might have used laughing gas at one time or another, but that's a whole other matter.
Yeah, no, the kind of anesthesia that I do is like deep, all the way, general, paralyzed. We're taking out pieces of people's lungs, putting in stents, all that sort of stuff. So this is a new venture that I'm doing. I did my first ever comedy stand-up set at the Dallas Comedy Club in late November, and it went well. I would say I got a couple of chuckles, but as a first-time comedian, I felt that it went okay. And I didn't really think anything of it, but it got picked up by a few friends, and I am so excited to announce that I will be performing a set at the Laugh Factory in Hollywood on January 24th.
So January 24th, set your calendars, everybody. Laugh Factory on Sunset Boulevard. It's a iconic comedy club on that strip where all the comedy clubs are, but it's the big one of the big ones, and you can go see Tiffany there. We have an exclusive clip of your stand-up. May we play a minute or two?
What is that? I'm like, damn.
Yeah, heard it.
For real though, because my job is to put people to sleep. If some of these jokes, aren't that good and y'all start getting a little drowsy, just know that I'm really good at my job. I'm gonna warn y'all though, because my husband's sitting in the front row and he's Korean. So he knows, yes, thank you, Korean man. He knows the entire Squid Game crew. So if I catch any of y'all sleeping during my set, I got the Squid Game crew back here, okay? I do love my job though, I really do. Anesthesia's so fun.
Well, we'll get into that in just a second here, why it's fun and what it is that attracts you to anesthesia. But congratulations, it's a big deal. That's what you call hitting the ground running, going all the way to the Laugh Factory. Are you going to do some open mics between now and then to kind of hone your craft?
No, I just practice on my family and friends. I bribe them with wine, and then they have to sit, and I practice my jokes in front of them, and they give me feedback.
So that's, again, you're sort of using your anesthesia instincts in how you approach your audience. Maybe you ought to apply some of that in the Laugh Factory and sort of buy something for the room, or maybe pump some halothane in or something.
Yeah, I have my own private wine label, and so I plan to use that to get the audience at we want a blood alcohol level of like around 0.05 to 0.08, where they're loosened up, but not like about to black out. So that's the sweet
be
spot.
careful.
I plan to give everyone.
Yeah. It's good. I fully endorse that. However, the alcoholics, you should not apply, number one. And number two, in California, the driving laws are very stringent.
So Uber to her show.
So everyone Uber. She's going to get you loaded. Yes. So Uber to the Laugh Factory, which is not a bad idea anyway.
Yes. Yeah, because the parking there is not that good.
That's right. It's kind of a wacky parking situation. Okay, now I want to dig in a little more into your stuff. First of all, you mentioned that this was a toxic year. Was it toxic for the same reason it was for the rest of us, that COVID was a shit show, or were there other things going on in your life?
Both. As a full-time physician working during COVID last year, when it first started, honestly, as naive as I was, I sort of felt like it was a sprint to the finish line. And I paced myself as if I were doing a sprint. And then when during the summer it started to defervesce and you saw the curves come down, I was like, oh, okay, we're kind of coming to the finish line. And then Delta reared its ugly head. And now we have Omicron rearing its ugly head. And I have come to the realization that this is not a sprint. This is a marathon, which means I need to adjust my running pace for a marathon, because I'm not going to make it at the pace that I was running back then. And I've had to adjust a lot of my sort of mental well-being, because I was always one of those people in medical school and residency. I needed a rest. I don't need help. Sure, I'll take an extra call. Sure, I'll wait and do the add-on case. I prided myself in being a soldier that never complained. And whenever people talked about mental wellness and burnout, I would always, oh God, they're just so weak. And now I am, totally swallowing my own words, because for the last year, I'm like, I need to focus on my mental health or I'm not going to make it. I cannot help other people if I'm a pool of tears on the floor.
Yeah. So I'm guilty of the same thing. So it was great when I was a medical student and resident, because I got to do and see everything while other kids were sort of sitting back on their hands. I was in with everything, and I had this amazing clinical experience all the way through. But then, like you, I continued into my working life with the same thing, the same hours and the same insanity. And you can't do that very long. You can't. You have to balance it out. And it's interesting to me that part of your balancing is exploring other things like comedy and that kind of thing. And that's it's a really interesting thing for physicians to do. How are your peers embracing this new pivot?
I will be honest, before I started on Real Housewives of Dallas, I went to a number of my peers in the hospital, and more than not, I got the response that I should not participate on the show. It seemed to them that there was a negative connotation to being on one of these housewives shows where you're sort of egged on to have drama with other ladies. And let's be honest, the show is not exactly meant to be inspirational, and it's meant to be a little bit of a car wreck. And I had one mentor whom I highly respect, and he said to me, Tiffany, you have worked so hard your entire life. You graduated from medical school, AOA, when you were 23 years old. You went to the best residency program in the country. Why would you shoot yourself in the foot and join this housewives show when you don't really need that? You're going to lose all your professional credibility. And I said, respectfully, sir, I disagree. Because I work so hard. I read all the peer-reviewed journals. I do clinical research. I mentor and teach medical students. And none of that changes because I'm now doing this show. Like, why do people make those things mutually exclusive? Like, why can I not be both?
Right. So I got the same feedback.
Did it.
I got the exact same feedback. I was a resident at the time. I was doing a once-a-week radio show, and it caught a little wind, and there was little write-ups here and there. And my residency director went ape shit on me, told me I was going to ruin my career, and I had to listen to him because he was going to save me from these horrible choices I was making, and there was something wrong with me, et cetera, et cetera, et cetera. I stopped for 6 months at the time, and then slowly went back to it. What happened in those 6 months, Dr. Anthony Fauci, came around and started making a mandate to all physicians, to go out and educate about what was then HTLV3, you now know as HIV. And that was what I was already doing. And I thought it was an important thing to do. And I thought, well, wait a minute. I shouldn't be crushing my own instincts that this is the right thing to do, to get out there and talk to people about this thing that no one's talking about. I got to go back and do it again. Fast forward 3 years, I'm a senior resident. My residency director walks up to me and goes, you still doing that radio thing? And I thought, oh, here it comes. He's going to do it again. I go, yeah. And he goes, I'll tell you what, I'll take over now. Let me do it. And I was like, oh, I will never forget you, asshole. I will never forget you for this. And what I learned mostly from it was not so much that this was a bad guy, because he made me his chief resident the next year and all this stuff. So all was forgiven by the end. But I really learned not to question the instincts of young people. I was 25 years old or something. I thought it was the right thing to do. I would say you fit that same profile, and the older mentor types that may have a certain degree of anxiety or envy about what you're doing, just don't listen to them. Take it in, try to, sort of reach a balance with what they're telling you, but don't listen to them. That is, the young people have instincts that they don't have. They don't see the landscape the way you do. They haven't grown up with a Real Housewives show and understand how it fits in with somebody who's also an anesthesiologist. You understand that. Good for you. Fully endorse what you're doing.
Thank you. That means a lot to me.
Good. Why did anesthesia, Ms. Kondo, why did that spark joy for you?
I don't know if you know too much about me, but my friends that know me well would maybe describe me a little bit as a control freak. Impatient. I don't like to assess patients and then write prescriptions and then return to clinic in 6 weeks. I just cannot deal with that. I want hands-on, immediate gratification. If the artery cut as it was recently, and I have to give 56 units of blood and keep the pressure up and start massive transfusion. I like that. I revel in that sort of acute, high intensity environment. And they say 90% of anesthesia is boredom and 10% is sheer terror. And I think that's just perfect.
You could have satisfied a similar instinct with intensive care medicine or cardiology. It's very, very similar, although you do have the outpatient stuff that it doesn't sound like you like, but you could avoid all that. You could be an interventional cardiologist or an interventional radiologist. Did you think about those things?
I did. And one of the things that I really love about anesthesia is that, like, last Tuesday I did urology, then yesterday I did orthopedic surgery, the next day I am doing a free flap, a deep reconstruction. And so I get to liaise with lots of different specialties, and I kind of like that.
Also, it's what, you did a 4-year residency or 5?
I did a 4-year residency, and I took the echocardiography boards as grandfathered in, but I didn't do a fellowship.
Right. That's as opposed to doing 8 or 9 years to be an interventional cardiologist, which is a lot ridiculous.
Or 7 to be a neurosurgeon, which is, I found the essay that I wrote.
What did you think about that?
And I wanted to be a neurosurgeon. You know, we were cleaning the house.
That's a total, no.
I don't think I would have been a good neurosurgeon.
No, that's a totally different vibe. Yeah, no. The story you told about the orthopedist in the operating room, I will, I guess, refer people to your video if we can do. Is your video up on your website of this particular stand-up?
Yes, it is. And my brother is an orthopedic surgeon, so that joke was specially made just for him.
Okay, but you would have to be sort of constituted like that surgeon to be a neurosurgeon. You know what I'm saying? That's not right. You wouldn't have been. And by the way, one of the reasons that people don't understand this, that one of the reasons people go into certain subspecialties is the peers. They go to these rotations. They go, hey, I like those guys. I like the guys who are in urology. I like the guys who are in psychiatry. I like the guys who are in anesthesia. I could get along with them. They seem nice. They're having fun. I enjoy what they're doing. That's a big reason people go into certain specialties, and people don't understand that.
Yeah, it's like, when you, if I don't know if you were in Greek life, but when you pledge sororities and fraternities, and there are certain ones that vibe with you, and you're like, oh, I like that one. That's kind of how picking medical specialties goes as well.
Yeah, it is. It very much is, which is weird for people to think that way. But I also had this thing where during my 3rd year, every rotation I did, I thought, oh, this is what I want to do. And the last one I did was internal medicine. And I was like, oh, that's right. That's why I came here. This is what I came here to do. I forgot. I got interested in all these other things, but no, I came here for this specific thing. And it fit for me, even though I ended up going way deep into psychiatry for many, many years as well, 30 years. So let's see. So back to COVID and the toxicity of this last year. I'm guessing you were intubating lots of people throughout the day and night, or is it in your hospital, does the ER do that?
Yes, I work at Dallas County's public hospital. So, we get a lot of trauma, a lot of underserved patient population. And I worked full time during the entire pandemic, intubating people, taking care of them. Some of them were COVID status unknown because they would come in from a car accident and we didn't have time to COVID status them. They're like bleeding out. And so I just had this constant anxiety that I was going to catch COVID from taking care of patients and then bring it home for my family and get my elderly parents sick. And I'm a little bit of, in case you hadn't figured that out, I'm a very anxious person. And I think one of the reasons that I excel in anesthesia is because I worry about so many things. And then I prepare contingency plans for if those things happen. And then it sort of just reinforces the fact that I prepared for it because I'm like, see, I knew I should have gotten blood in the room.
No, that's right. And I'm certain that you have what I have, which is anxiety that overlaps with OCD. And that anxiety OCD overlap is a perfect asset for physicians. Well, particularly in certain subspecialties. And I used to get very harsh on my residents when I always say, look, defend your position, defend the decision you made. But if you don't have a backup plan and you can't tell me what that is, I'm gonna be pissed because you'll make wrong choices, and I can't fault you for that. Just as long as you can defend your choices, that's all I'm asking. But you better know what you're going to do and be on top of it when it goes bad.
So much trust goes into the person that put you under.
Yeah, I was thinking about that. So I had I've only been under a couple times, but I had a full radical prostatectomy, Da Vinci with the Da Vinci. And I remember going under, talking to the anesthesiologist and thinking, oh, well, good luck. We'll see how this goes. And tell people don't understand what general anesthesia is, in terms of the curare or whatever is used, the paralytic agents and that kind of stuff. Explain to people what you're doing there. And by the way, how a lot of it with the gases and all, we're not exactly sure what the brain is, what that's doing to the brain. But go ahead, to the best of what we do know, go ahead.
Well, most people, I would say, get a general anesthetic, meaning that you're completely asleep out. You get an IV in the preoperative area. We usually
and I'm going to interrupt you. I want to interrupt you, Tiffany, because I really want people to get this. You're not asleep. You're sort of dead. You're under the control of Dr. Moon. You're specifically not asleep. Yes. Your brain is shut off. It's not like your brain isn't sleeping. It's shut off. The activating system is down. Yeah.
We have quieted all your neurons. We take over all the physiologic processes of your body. I breathe for you. Your heart beats by itself, but if it doesn't, you have arrhythmias, it stops. I restart it. Blood pressure's too high, I'll make it lower. Blood pressure's too low, I'll make it higher. If you're losing a lot of blood, I give you blood. I give you medications during the surgery to keep you paralyzed, because generally surgeons don't like a moving target. I give you medications so that when you wake up, you won't be in excruciating pain from this large operation that you just had. So basically, I am controlling. I am like the CPU of human body.
And I love that. And it's different than what you get for like an endoscopy or colonoscopy or something, where you might have an anesthesiologist handy to give you something like propofol, which is a little more than just Versed. Again, which is why for people, when I first heard that Michael Jackson was getting propofol in his bedroom, that was just the most stunning thing I'd ever heard. Giving propofol out of a surgical suite was like, or an ICU. I couldn't believe my ears. And that a cardiologist sort of participated with that was too much.
Yeah, I have a whole lecture that I give to my medical students and residents about anesthesia, true and false in the media. And the Michael Jackson story is definitely a part of that, where his cardiologist basically set up like a recovery room in home with a portable monitor and had an infusion of propofol for him, his insomnia. And just to be very clear, insomnia is not an indication for a propofol infusion. And the pharmacokinetics of a propofol infusion is you get a little too and the patient stops breathing, and then his cardiologist went to take a phone call while it was still infusing, and then he basically just stopped breathing and died.
Yeah.
He killed the queen.
By the way, I know. I don't know if you know the whole. I'm sorry. I got Omicron a few weeks ago, and so I've still got a cough from that.
And it's dusty in here.
But
I got to clean the house.
Yeah, it was nothing. Believe me, it was nothing. I got Alpha too a year ago.
Except for the nagging cough.
Alpha was impressive. That was impressive. Omicron is a nothing. I assure you. If you have natural immunity or vaccines or your booster, that kind of thing. But to be fair to Dr. Conrad Murray, it was an anesthesiologist that first introduced him to propofol and used to tour with him with an anesthesia cart, which is again, that's a surgical cart. That's something that is in a surgical suite, not in somebody's hotel room. It's so insane. But and not to disparage, I don't know that anesthesiologist. I don't know what he was thinking, what was going on. But I have treated a number of anesthesiologists for addiction. It's probably my number one category, subspecialty with addictive pathologies, I'd say. Followed quickly at hand by by psychiatry and then high-flying things like, cardiology and interventional radiology, stuff like that. But anesthesia, a lot of people go into anesthesia because they like altering. They like the whole
But
phenomenon.
if you take propofol like Michael Jackson and that's how you sleep every night.
It's not how he sleeps. It's not. That was full on drug addiction. That was just flat out.
Right, but it's got to screw with your body. Like,
it's insane.
You don't really go into a REM state.
He was crazy.
Right? No. Yeah, that's not sleep. That is anesthesia. Here's the way you do, just for
Michael Jackson crazy. What are you talking about?
But for by the way, not his fault that doctors strung him out on drugs. I don't blame the patient when they get like that. His dermatologist was putting him on giving him parenteral opiates 3 times a day. Why was he going to the dermatologist 3 times a day for parenteral opiates? So please, that guy, that's the physician part of this is the disaster, not the patient.
He had a lot worse problems, trust me.
I feel so bad for him. So bad. Hang on. Yeah. What was I saying? I lost my train of thought.
He taught us a lot about this.
So I've had COVID twice. I've had my vaccine and everything. Have you had COVID yet?
I've never had COVID. I checked my antibody levels. There's a quantitative level you can get. I've knock on wood, never had it. I am a very, very careful person. When I come home from the hospital, I take off all scrubs and do a decontamination shower in the outdoor garage that's attached to our car garage, which I made fun of my husband when we were building this house. I was like, why are you spending so much money on having a shower outside? Like, who wants to shower outside? And now every day I use it. And my husband's like, see?
That's awesome.
How have you thought of how you're going to deal with the comedy clubs? Or how did you deal with the one you were in the other day?
My first comedy set went well. A lot of my friends were in the audience, so I feel like, they gave me a lot of sympathy, laughter. I did imitations of my mom because that's what every comedian should start with is imitations of their childhood. Did a few silly things, a little dance. I had my own rendition of Cardi B's WAP, which was very poor. I think I pulled a muscle during
Susan
it.
likes that.
That sounds funny. But how are you going to deal with the COVID flying around in those comedy
clubs? Are filled with they're COVID clubs.
Yeah, that's the only problem is that's where a lot of the
we're going to have to go in. We got to exterminate the Laugh Factory before all of us get in there and just hope for the best. My set is only 6 minutes.
Free COVID test at the door for everybody.
Blowtorch. Hey, to be fair, if you just keep the air moving, air flow is more important than probably anything we know. Although Omicron's a rough one.
Take your vitamin D.
Take vitamin D and that stuff.
I think it's more in the backstage area anyways, because when you go backstage, you're in a very small room, so you just wear a mask when you're back there. When you're on the stage, I don't think
I've got my mask.
Susan, you and I did a podcast, I think, at the Laugh Factory. Right?
Oh, we did? Yeah. No, that was the Improv.
No. Well, we had to go up. It was Andy's shit show upstairs there.
Oh yeah, that one.
So there's a lot of room upstairs. That's not so cramped.
And Drew remembers every green room. He has a steel trap for memory. He can remember I don't remember anything.
Tiffany's got the one that I admire. I've got the elderly version of that. So.
That's funny.
Okay, here's somebody who has a question on the Restream. This is flying around a bit, and I'm going to see if you have any opinion about this. There have been reports of alleged escalating reports of syncope and sudden cardiac death amongst athletes, particularly soccer players in European soccer leagues. Do you have any opinion about that? And B, any theory about that?
I was not aware of that news, but in my medical training, anytime I hear about a young athlete who's exerting himself, the first thing I think of is HOCM, which is hypertrophic obstructive cardiomyopathy, which tends to be undiagnosed until someone has like a, sudden cardiac issue.
Event.
And it's just because the outflow tract of the aorta, and it happens in like young males. So that would be my leading diagnosis, but certainly we need to get these people seen.
Right. So it'd be hypertrophic cardiomyopathy. It would be congenital defects. So here's what I've been saying is, because everyone wants to hang it on the vaccines. And I'm saying, is this true? Yeah, but here's what people have to understand. Is it true? It's just simply, as you pointed out, there's a lot of hypertrophic cardiomyopathy in athletes, and it's always been that way, and that's the way it is. And so are there actually increased cases, number one? Number two, what is the cardiac pathology? What are they seeing? When they do the echocardiogram, are there congenital defects? Is there aortic outflow obstruction? What is going on here? And then number three, is there any association with vaccine therapies? Like, were they done within the last month or something? Or is there any myocarditis evidence? I see none of that in the press. So the fact that we see none of that leads me to believe that there's smoke and no fire, that there's nothing here. I think it's probably just the usual, as you said, hypertrophic obstructive cardiomyopathy, which has happened in athletes forever and is probably nothing new. But it's an interesting phenomenon, and people should take it very seriously and look very carefully at it. But I can't imagine doctors not doing the diagnostic workup on these guys. And then why aren't we hearing about it if it's related to something unusual? So I'm saying that nothing going on here. Let's take a couple of calls. You up for that?
Yeah, I love it. I used to love hearing you take calls from Loveline. I wasn't supposed to listen to it, but I would.
What, your mom didn't like it? She didn't approve of it?
No, but I had a little when I'd turn it on real low and I'd listen to people,
sorry.
confess
apologies
all
to
their
your mom.
secrets.
How old were you? How old were you?
I was like 14, 15.
Oh, wow.
That's appropriate age. One thing I didn't mention is Tiffany also has some lifestyle products. She has candles, Eternal Moon. We got
she's been busy.
Sales go to the Family Place. Tell us about that. Jewelry. Wow.
The Family.
What is the Family Place?
The Family Place is a domestic violence organization that provides the most domestic violence services in the state of Texas. We have so many women and children and dogs and a few men that we help. We help them get out of bad situations. We try to find them new jobs, find safe shelter. I'm on their board of directors. It's my second year now. And I give a portion of all of the candle sales to the Family Place. And last year we were able to raise over $10,000 for them.
How did your family, are you a first generation immigrant? And I think, is that right? Or second generation? First.
I am. I moved to America when I was 6.
How did you guys end up in Texas?
My dad finished his PhD and he had a friend that worked at Texas Instruments and was like, hey, dude, I can get you a job here. And so, as weird things happen, I moved to New York to Texas. And then I was like, where's the subway? How do I get around? And I was like, and what happened to all the Asian people?
It's gotta be weird. Texas. You like Texas now? Are you a convert?
It's fine.
Oh, are you thinking about leaving? Going somewhere else?
I have 4 children and I have 4 children in private school and a really large mortgage. So I think I'm here for a while. Although the other day, because I've been going to LA so much for a few upcoming projects, we were thinking about maybe buying like a condo or something in LA.
Nice.
You have to let us show you Pasadena. That's where you want to stay. Trust me, if you're out here, way better than the rest of the nonsense in LA. And I'm aware of your twins. Keith, I'll be right with you. Hold on a second, my friend. Where'd the other 2 kids come from?
I have 2 sets of twins. Yes. My husband was previously married. Yes.
Oh my God.
So 2 older twins that are applying for college right now. They're seniors in high school. They are not my biological children, but I met them when they were 4 and we are very, very close. And then I have 7-year-old twin daughters. So we have 2 sets of twins.
And where are they looking at? Any specific plans?
Nicole just got into Pepperdine. And Nathan just got into the University of Seattle, which is his #1 spot.
Nice. Oh, good. Congratulations. That's good. All right, Keith, we got you now.
Well, it'll be a little bit quieter around the house.
Yes, it will. Keith, sorry, buddy. What's going on?
Hey, Dr. Drew, Susan, Caleb, you all live.
You live, Keith. What's happening?
Great interview. Hi, Dr. Moon. So my 70-year-old mother just tested positive for COVID on a home rapid test. Fever off and on. She's been quite uncomfortable. We're waiting on a response from her physician. Staff read the message a little over an hour ago. Symptoms started on Monday, so we're on day 3 now, hoping to get her considered for Paxlovid if she doesn't have conflicting meds. I wanted to know if you've had any luck finding it in stock at any pharmacies right now.
Okay, so excellent question, Keith, my friend. Is she triple vaxxed or vaxxed at all? What's going on there?
Vaccinated, boosted.
All right. So in all likelihood, this is going to be pretty mild, though it can still tip over elderly patients. It can get them into trouble. You have to be careful, but this thing is pretty mild. So the boosted patients do a lot better than everybody else. So that's good news. Paxlovid is an excellent choice for her. I have been searching high and wide for Paxlovid. I've called wholesale pharmacies. I mean, it's been unbelievable. To me, this is a national scandal, and why people aren't talking about this, I can't believe it. The medicine is available. It's being rolled out, and what is going? I can think of nothing but incompetence as the reason it's not coming out yet. Your mom is a perfect candidate for Paxlovid therapy, or at least molnupiravir, or perhaps the monoclonal antibody is actually probably not as effective because she probably has Omicron. And so she's a perfect candidate for one of the new antivirals, and you can't get them. It is disgusting. Where are you? Where are you now? Where are you living?
Hey, Caleb, tune up the Dr. Drew Fights Back, please.
Thank you, Keith. Thank you.
We're in Sacramento.
California. So I talked to multiple, and even Anthony Brown looked around. He's
yelling so loud, it's reverbing.
And Anthony, put on the restream what you discovered from your pharmacy friends. Essentially what I kept getting back was California is a shit show. We can't get it. We don't know when we're getting it, this kind of thing. Tiffany, what's going on in Texas? Can you get it there?
Texas is a shit show as well.
Yeah. And don't you agree? This would be a perfect opportunity to use one of these medications, right?
Keith's mother sounds like a perfect candidate for that.
Yeah. Yep. So keep fighting, my friend.
All right. We're gonna try.
Yeah,
we got a couple days before that 5-day window. Closes.
I know,
and then it's the monoclonal. We got 10 days for that.
I guess in the meantime, start looking at the monoclonal, which have been in certain counties equally as difficult to come by. but at least that's out there. And if you can get the blanking on the name, Sotrovimab, is the one that is still quite active against Omicron. So. Keith, my friend, stay well.
Thank you, Keith. Hey,
let us know how it goes.
I got to give you guys on Clubhouse a little note. If you're going to call in, use the earbuds, or just turn the volume down on your iPhone so it doesn't reverb back into. Because when Drew yells, it comes back.
Right. So when I yell, just
when he strikes back, it comes back.
Mute your mic.
Yeah, or slow it down, or just tone it down a little bit.
So Tiffany.
I could hear his voice perfectly though.
It's good. Tiffany. So I'm pissed, right? There have been so many aspects to how this pandemic has gone that have been astonishing, disgusting, mortifying. This is one of them. This is just one little area, which is the distribution of an antiviral product that is available, and they can't seem to get it in the hands of the pharmacists. What else have you run into that has upset you during this thing? I know we all had our own experiences with it.
A lot of what's frustrating to me is that there seems to be a disparity at the beginning of who was able to get the vaccine and who wasn't. Now that's kind of evened out. But now with the testing, like the PCR tests are taking 3 days to come back. And so during those 3 days, people are just sort of, if you can even get one. I waited in line for 2 hours to get one. And it's just an accessibility issue, decreased productivity from people just waiting around. It's just, I don't know. I feel like there needs to be a better system here.
Right. That's right. It has been, I don't know what else to call it, but a shit show. And it is like, this is, it's so astonishing to me. And the other thing, on the sort of, I don't know, something happened. How did your hospital deal with people coming into the ER? One of the most astonishing pieces of this experience for me was ERs and doctors telling sick patients, go home, come back when you're sicker. I've never seen that in my professional career. At least you'd say, check in with me twice a day and give me your O2 monitor and let's see what's going on here, as opposed to just scram. We'll see you when you need a ventilator. That was just the most unbelievable chapter of this whole thing, and that went on for a good 3 or 4 months at the beginning. And people were trying stuff. I mean, fluvoxamine was available. Decadron was available. There were things you could do that now have shown to have evidence basis to them that had you been sort of aggressive and improvising at the time, you could have helped people. And instead, go home. We'll see you when you need a vent. Unbelievable.
Yeah. I was not down in the emergency room triage. I think I'm a little bit protected because I work in the operating room. So it's sort of like by the time they get to me, someone has already.
Yeah, I get it. And I don't want to blame our ER colleagues. I'm really not blaming them. What I'm blaming is the infrastructure that told doctors don't treat, freeze in place. You do anything different than what protocols we approve, we're gonna sanction you. That was disgusting. It was disgusting. And I hope there's conversations about that. And to me, it made me aware of how many physicians are employees of large systems where the systems determine the practice of medicine. That was a shock to me, a shock to my system.
I am one of those people, and I practice in a manner that is in accordance with the governance rules that are passed to me, which
by the
I may
hospital.
not always agree with personally. They tell me what to do,
hospital.
and I do what they say. Exactly.
That is problematic. I remember the beginning of that stuff. We called them clinical pathways, and I remember when that started, I thought, oh, this isn't going to be good. This is going to lead to just recipe books, and people are going to get hurt because of it. I don't know. I'm for monitoring each other and staying on top of things, but I don't know. I mean, what happened to our judgment? I don't know. Anyway.
It's been disheartening.
I think everybody was scared shitless.
They were scared shitless, but the job
and just didn't want to. You couldn't do anything.
But the job was to help patients, and people were afraid of social media backlash. They're afraid of their hospital systems. They were afraid of their state medical society. They were afraid of everything, except what they should have been afraid of was not serving the immediate needs of the patient. That's the only thing. We
talked to a lot of doctors where before the show they'd be like, "Well, between you and me, I know
a lot of that."
And because the organizations that they work for were just out of control, controlling everything. That's what it seemed like to me. Just my impression.
Hang on, I'm looking.
Well, at the beginning,
supporting the. Go ahead.
Oh, no, I was just going to tell a personal experience. At the beginning of COVID, we were told to undergo a mandatory training session about proper donning and doffer of the PAPR device to go to the ICU to intubate no COVID positive patients, because you have to remember, I'm intubating these people. So there's like COVID particles all up in my face. So they taught us how to properly put on and take off the PAPR device, like the spaceship suit. So at the end of the training session, which was mandatory, I took a picture of myself in the space suit and I made a cute caption saying like, today's not my usual fashion Friday, but I think this is just as fashionable or something. I was reprimanded by the superiors of my university for making light of the COVID situation. And I said, I am trying to bring a little levity to a situation because I walk into work shitless every day that I'm going to get it and come home and give it to my family. And I just posted one simple picture. I wasn't wasting any PPE. I was sort of encouraging people, letting people know that our hospital is giving us proper training on how to take care of these patients. And I got in big trouble for that.
Please continue to fight back. I am telling you, one of the duplicitous and perhaps the most problematic populations that perpetrated a lot of the trouble in the excesses, or the excesses in either way, undertreating and overtreating, or underreacting, overreacting, was academic medicine. Academic medicine behaved in ways that was reprehensible, and that needs to be examined carefully. There was a lot of excess that was unethical, inappropriate, hurt people, and all you were doing was trying to bring some optimism to a situation where they would rather panic people and precipitate mental health crises. Congratulations, academic medicine. Job well done. Well done. Mission accomplished.
And now nobody wants to be a doctor.
Yeah.
Oh, so we've had a mass exodus. Yeah. And all I can say is that I have shown up every damn day of my job. Yesterday, there are multiple patients with known COVID who have cancer. Well, cancer will not wait for your COVID. We need to get your liver lesion out. And I take great pride in taking good care of my patients. And I will not take this extra, whatever it is that people are giving to me. I show up for work every day. And I do a damn good job at my job. And I'm proud of it. And I'm sick of all these people telling me otherwise.
Good for you. And thank God you did Real Housewives. I mean, you have that sort of in your quiver as a life experience. It was something fun and different.
Right.
And I understand it's burdensome, but in a weird way, you have that to help you deal with the what you're dealing with on a day in, day out basis with the patient population.
Yes, I describe it as both the worst and best part of 2021.
Yeah. So, listen, we got to take a quick.
I hope 2022 is better.
God, so far so good.
We're doing okay. So we're not going to do well.
Yeah, I really think people have a hunger to restart their lives, to be social, to move about. I mean, it's an appetite, like a hunger for it, and people want to live, and not living is not living. let's put it that way. So we're gonna take a little break. We're here with Tiffany Moon. You can see more about Tiffany. It's tiffanymoonmd.com. Is that right?
Yes, tiffanymoonmd.com across Facebook, Instagram, Twitter, and most importantly, TikTok.
Right. And go look up that. Where did you paste the
drdrew.com/moon?
Where did you paste the
video,
the space
Dr. Drew
picture? Because I want people to go on the picture of your.
Dr. Yo, our other anesthesiologist friend, has a picture like that. It's like he's all covered with.
He does a lot of social media stuff, and he just tells them to buzz off when they come after him. Yeah, but everyone go make comments, supportive comments. Was it on Instagram or where? Twitter?
Did they make you take it down?
It was on Instagram, but I was told to take it down.
Yes, you don't. You're not allowed to keep it up when you get in trouble. And that's like the worst feeling. That's the worst feeling.
Yeah.
I hate it when that happens. And you just feel like so deflated and you feel so shamed. And you're like, Jesus, for this? Like, are you kidding me?
Our buddy Leopold said the medical profession has lost credibility. Dr. Moon, you and everyone else has a gun to your head because the woke Twitter mob will dox you, threaten you. You could lose your license. That is true, Leopold. There is always that group hanging around and have attacked several physicians. Finally, the medical literature are starting to actually talk about this. Should there be sanctions? Should the licensing be encumbered or not? And I'm always stunned when you read the pros and the cons. Those in favor of it really don't want physicians to have free speech, and that's really, to be a physician, you have to give up one of your constitutional privileges, like consciously. Weird. Anyway, we're gonna take a little break.
Haven't we given up
back
enough?
with more calls. Yes,
Yeah, right.
thank you. See you in a minute. Anyone who's watched me over the years knows that I'm obsessed with Hydralyte. In my opinion, the best oral rehydration product on the market. I literally use it every day. My family uses it. When I had COVID, I'm telling you, Hydralyte contributed to my recovery, kept me hydrated. Now, with things finally reopening back around the country, the potential exposure to the common cold is always around. And like always, Hydralyte has got your back. Hydralyte Plus Immunity, my new favorite, starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single serving easy pour drink mix contains 1,000 milligrams of vitamin C, 300 milligrams of elderberry extract. Hydralyte Plus Immunity comes in convenient, easy to pour sticks that rapidly dissolve in water, make a great tasting drink, has 75% less sugar than your typical sports drink. It uses all natural flavors, gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydralyte Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy, or as always, you can find it by visiting hydralyte.com/Dr. Drew. Again, that is hydralyte.com/DRDREW. Be sure to use the code Dr. Drew 25 for a special discount.
And Hydralyte works for COVID.
Yeah.
It really does hydrate you and make you feel better. And you can find it at CVS now.
And it's at the front desk of places too, which is amazing.
We're going to make a new ad though.
Serenity Freedom said, my eyes look tired and sad, Susan. So evidently I do look tired today.
Well, you got up at 5 a.m. to do Ian. Tell us all about that, because how was your day, honey?
I've been vaxxed. I've had COVID twice. I got over COVID a couple weeks ago. But of course, because I had to go do a project over at NBC, I had to get a PCR 2 days ago, and then I had to get up at 5 a.m. and go get a rapid antigen test before walking on a set. I mean, it's zero probability of infectivity, zero. But off we go.
But you also got up at 5 a.m. and you got to see Lonnie Love, who
it was great, and Justin. So
and you're doing it tomorrow the next day. So
yes. Well, no, we're doing an evergreen one that they'll air some other time.
Oh, okay, but it was E-Pop. Oh, what is it? E-Pop Live?
Daily Pop Live.
Daily Pop Live. And they made a lot of fun of you today. I loved it.
Yes, they did. Well, it's Lonnie and Justin.
It was fun.
Yeah, it was good. I love them. And Tommy was there, our buddy, the stage manager.
Yeah.
I was trying to get him in there a little bit.
It's so fun to see you on TV again.
Well,
you're very good at it.
Thank you. It's very kind of you to say that. Because trust me, Tiffany, if she has notes, she will give them to me. Trust me.
And you brought light to Euphoria, which that show on HBO.
Yes,
which
Euphoria, for the record,
addicted to.
For the record, Euphoria is one of the best explorations of addictive pathology I have seen in media ever. And what I was emphasizing on the show this morning is that's where substance use disorders takes people.
Yeah,
they're not horrible people. The disease takes them to a horrible place. They behave in horrible ways. When they're recovering, they're wonderful. But when they're in the illness, their brain is not working right, and it drives them to terrible places.
Yeah.
Euphoria is a beautiful exploration of that.
Yeah, it really is. It's scary, though.
Yeah, and Tiffany's vigorously nodding her head.
And also be sure to
give
everybody a little shout.
And I also...
sorry.
No, go ahead. Sorry.
No. You're our guest.
I just wanted to say Euphoria is so beautifully well made, and it captures the feelings surrounding addiction. And you see that it's not bad people, that they just fall into bad situations. And I also have to make a plug for one of my favorite books that I read in the last 2 years, which was Dope Sick, which I think has been made into a TV series, but because of the opioid crisis, which I have a personal involvement in, Dope Sick was just such a good book, and explained to me how people in middle Appalachia with back pain who lost their jobs and now all of a sudden they're addicts, and it's like they're not bad people. Like it was just a slippery slope, and we need to help.
However, Tiffany, I have to tell you before you join the ranks of your anesthetic colleagues, anesthesia was perpetrating, or anesthesiologists that went into, quote, pain management were the primary perpetrators, at least in California. And I was fighting it constantly. And my patients were being knocked off one after another. And I was being told I was opiophobic, I was old-fashioned, I was interested in patients suffering, I was going to be sanctioned by JACO, CMA, Department of Mental Health, California Medical Association. They were all on my ass because I was saying this is a catastrophe and we must take a look at it. And I'm telling you, another case in point, if you have really great instincts as a physician, if you see stuff going wrong, even though an entire discipline develops around it, speak up, because you'll be right when the day is done. It was a horrible chapter. During the whole evolution of what you saw on Dope Sick, I was running a large treatment center in a psychiatric hospital, and we were seeing these patients hand over fist. Put up my book, Cracked, Caleb, because that book was sort of a fictionalized version of my experience running a program. And some of it was in the face of all this stuff that was going on in the 90s and early 2000s. Thank God, no. Cracked, not the mirror effect, cracked. Thank God that the truth has a way of restoring itself. Sanity has a way of coming in. So I'm hoping that a lot of the stuff going on in the country right now and in our profession and all that's been going on through COVID is going to sort of wash through the system in some way, and we're going to come out with some more sanity on the other side. And to be fair, it's a synthetic process. We go all one way, and then we go all the other, and then we bring things together for a synthesis, and we learn from all the mistakes we made. I hope, I trust.
Yeah, for sure. I mean, those pain management physicians that were writing prescriptions for 40s and 60s of OxyContin, without even doing a physical exam. I mean, the pill mills, basically, those people deserve to lose their medical license and maybe serve jail time because they have killed
Tiffany,
thousands of people.
I don't disagree with you. I don't disagree, but let me tell you what happened then. What happened was the Veterans Administration and then JACO, the Joint Commission, adopted the policy that pain was the fifth vital sign. Did you ever hear that? That was more important than the pulse. I don't care what the pulse is. What's the pain scale? Pain is the fifth vital sign. Then it became pain is what the patient says it is. You're not allowed to discuss it, question it, analyze it, try to understand the context. It's what the patient says it is. Then the axiom became pain control is what the patient says it is. So if pain is what the patient says it is, and pain control is what the patient says it is, you don't need a doctor. You need the patient just to tell you what they need for pain control. And in Florida, that they actually adopted that policy where you could walk into a doctor's office and just walk up to the pharmacy and go, I want, Dilaudid, I need some Demerol, I need some, and that was it, because it was on you. You decided what pain control was. Oh, my patients took full advantage of that. It was on for a long time. And a lot of them died.
Yeah, I'm glad that I don't do pain management. I'm glad that I do OR anesthesia. A little, you know what I mean? When I drop them off I'm done for the day.
Yeah.
Yeah.
And by the way, Suboxone, if it ever comes up, there's crack. Thank you so much there, Caleb. But if it ever comes up for you are managing pain, Suboxone there's the original cover of Cracked. Suboxone is really a jump forward in chronic pain management. I'm telling you, that's going to catch on pretty quick. Also, Caleb put your comedy video up on our website at drdrew.com/Dr. Moon, Dr. Moon. So that's up there now. People want to see the video. And let's us go to...
Is that right? Dr. Moon? drdrew.com/
That's what Caleb put up there.
Yeah, that's right.
We're going to take a call.
I also have a YouTube link.
Go ahead.
I think it'll go straight to your YouTube from there. I do believe.
It'll link to the YouTube. Yeah.
That's Caleb's work.
Anthony, you're up on the podium with us. You're by being here, you're also streaming on multiple platforms simultaneously. So thanks for joining us.
Superstar.
Hey, Dr. Drew, thanks for having me.
You bet.
I just want to get on here and talk about just mental health. You actually helped my nonprofit a couple months ago with a message, Spread Hope Like Fire. Do you remember that?
I do. Congratulations.
That's me.
Hey.
I just want to get on here and talk just a little bit about like mental health and what it's doing with COVID, like how they're connecting. In the field that I'm in, I'm a mental health professional. So what we're seeing really right now is madness, if I can put it in layman's terms.
Yes.
COVID remorse is a new term that I learned as a clinician.
Oh my God.
it is so bad that I have clients that feel like they are stuck in 2020 and everybody else has moved on within the pandemic, with having to take precautions and still having underlying conditions. That's part of the aspect that I'm seeing go on with the COVID remorse. And then I have the other ones, on the other hand, are, well, we were told in 6 months this curve was going to be flattened.
Yeah.
Now what?
The Dr. Z-Dog, who we're going to get back in here, is a really good clinician, internal medicine guy. He and Peter Attia have a podcast called The Drive. They did. It's up there right now. I think it's episode 148 or 149. And Z-Dog has coined the terms COVIDians and COVIDiots. That we've got people that are fully, completely wedded to being in the COVID vortex, and those that claim that it's a complete, conspiracy theory or doesn't exist. So we have the COVIDiots who deny everything, and the COVIDians who want to be in it forever, and all the rest of us in the middle. All the rest of us are somewhere in that spectrum.
That's pretty funny.
Yeah, COVIDians and COVIDiots. Not my words, his Z-Dog's. But you're right. And then I've been hearing more and more clarity about what the screens for schooling have done in terms of exposing kids to pornography and sexting. The average age of exposure, I think, has dropped down to like 8 now or something because of it. In fact, I had a teacher I was treating for a medical thing yesterday, and she told me that routinely she'll be in a classroom and a Pornhub banner will come up on one of the kids' windows because somebody was, click through on something. And these are 12-year-olds, 11-year-olds. That's what they're being exposed to because they're on a screen all day, as opposed to with their peers in a classroom or out in the play yard.
Yeah, that's what I'm seeing too. Is there's a developmental lag that we're seeing with the youth, especially the kids that I'm working with. They're just leaning towards a lot of the more darker areas of life, and it's like, how do we get support to these kids? How do we adapt to life post-COVID for these kids, because these kids are going to be our future.
Yes, sir.
How are they going to achieve and thrive in a world that they're set up to fail in?
Do you have a solution in mind? Are you thinking of something? I mean, just raising the issue. Hopefully we address it somehow.
Yes. In fact, the nonprofit Spread Hope Like Fire, what we're doing is we're trying to destigmatize a lot of the mental health that we are facing as a youth. In my area where I live, there's crime everywhere, and it's all youth. It's gang related. If we could get kids talking about their mental health, I think that would be a good stepping stone. But we have to be able to be vulnerable enough to share our own stories. And so that's like with our podcast that we have connected to the nonprofit. What we're doing is we literally have everyday people come on and share just what they're going through. Like,
is the podcast just called Spread Hope Like Fire?
Yes, it is. It's Spread Hope Like Fire, and you can find that on all your.
All right, so let's send people there as a way to sort of start to gather together and think about these things. And in terms of sharing our own stories, I had years of therapy. I have generalized anxiety disorder. I have a little obsessive compulsive disorder. Tiffany shares a similar biology with me. I can tell, which you can turn into an asset by psychiatric biology. Doctor. You can use your things. And if they bother you, you can get treatment to learn how to manage them and make them more productive. So that's all I'm saying.
Exactly. Dr. Drew, if I could just add, you had a large role in saving my life. You and Adam. Like I told you when I propositioned you for the video, you being open and I didn't grow up with a dad. You and Adam filled that void. That's where I got the idea of Spread Hope Like Fire.
Well, it's moving to hear that. It really is. And I appreciate it. And I said, you mentioned it to me and you said you were like a parent. And I said something like, Adam too? I said, really? Yeah. Adam also your dad? Okay. but okay. But okay. And you know who else said that to me? It was Jimmy O Yang, who, I don't know if you know the actor Jimmy O Yang because he came from China as a young adolescent and didn't speak a word of English and didn't understand the culture. And he learned sort of through Loveline and through Adam and I's goofing around, what he needed to do and perfected his language. Now he's a big star, and he doesn't have time for us anymore. Maybe
he's too big for us now.
So we'll get Fritz Stoller to bring him back. Thank you, Anthony. It's deeply moving to hear from you. Alana, I'm going to invite you up to speak real quick. We're going to wrap up pretty soon here, because Alana, Susan wants you here. So
I was gonna try to plug it at the break, but
here she comes.
Hi, Alana.
There you are.
I can.
Ilana, so she wants to plug this.
Oh, hi, Drew.
Hey, so talk to us about what I'm holding in my hand here.
The bobblehead?
Yes.
So we have I don't even know where to start. This was something that Drew wanted.
I wanted? Susan.
Yeah.
Susan wanted. Susan was talking about it, couldn't stop talking about it. And then you told her it was possible.
We want you to want it. Everybody needs to want one. So everybody go over to drdrew.com.
And then you guys got stuck in the supply chain problems.
Bubble.
And it was you and your husband that shepherded this thing through.
Yeah, but
we
were trying to get it for the holidays, but it got stuck in a container in Long Beach.
There you go. So here we are.
Yeah, well, we got it. It's it definitely feels and looks far better than I thought.
It's adorable.
It is. And
it's
so
my
we're
husband.
doing
He's cute as a bobble. He looks just like him.
Susan did a very good job helping us design it.
Well,
the
first version you look like Woody Allen, and I didn't. I
just want to thank Ilana publicly and your husband. Hopefully, it will be worth your time. So everyone, I'm going to put you back in the audience, Ilana.
Go to drdrew.com/shop.
And
take a picture of it in your surroundings so we can and put the hashtag where is Dr. Drew.
There you go. Did you know you did not know you're going to get involved with that?
You might win a prize. Did Alana have a question?
No, I put her up there just to say thanks to her.
Okay. Thank you, Alana.
So, Tiffany, we're going to kind of head towards the exit, wrap things up here. Are there other things we didn't get into you were hoping to talk about today, or anything that you have rolling around in your head you wanted to sort of respond to as a result of the conversation we've had so far?
No, I love everything that we've talked about. I think the only thing I was hoping to touch on is my line of aromasthesia candles that I created during quarantine.
Ooh, nice.
They are all named after anesthetic drugs. I have 4 new scents that I just debuted. We sell them online and give a portion of the proceeds to the family place. They all have snarky taglines.
Yeah, tell us the names and the tagline. It's very funny.
Okay, this is botulinum. I know you can't see, my connectivity is so bad. It's botulinum toxin. It's for humans who frown too much. And then we have oxytocin for my for humans who frown too much. It's Botox.
Oh, because it's like Botox.
It's Botox, okay, that's exactly. And this is oxytocin, which sometimes you give. Well, it makes people bond
pregnant
together.
People.
So pregnant people after delivery, right?
It is the feel-good hormone. Supposedly, when you have an orgasm, this is what chemical is released that bonds you to another human. It's also known as Pitocin, which is what we put in the IV bag when the contractions aren't strong enough and we need the. So its tagline is for humans who need a little push.
And that's very funny. And you guys use it to get uterine bleeding under control afterwards too, right?
Yep, a shot of pit in the bag to get the uterus a little less boggy. So I have 20 scents now, all hand poured by an all physician team here in Dallas. I'm proud that I was able to keep my team gainfully employed over the last 2 years. We donate the proceeds to charity. I think they smell really, really good. And that's my business and I love it.
Where do people go for it?
Tiffany Moon MD, and you just click on the shop.
And do you have a curare for people that need to be, slowed up a little bit?
Yeah, the curare dart has fallen out of favor. So our neuromuscular blocking agent of choice is now called rocuronium. And its tagline is for humans who need to relax.
There you go. That's right. You need to. I need some of that. I need to move around less. So
Yeah,
you
do.
Yeah. And what gases are you guys using these days?
We usually use sevoflurane or desflurane. Depends, personal preference.
And is there a candle to commemorate that?
Yes, we have a sevoflurane candle, and Sevo, when we use it for inhaled inductions for kiddos, it smells a little bit sweet, kind of, and so its line is for humans who are more salty than sweet.
That's funny.
Very good. Don't let the academic, what should we call it? I don't have a good word for it, but I want it to have a negative connotation.
Dirtiness?
No, it's the academic sort of bureaucracy.
In a nice
red
bureaucracy.
Red tape.
Yeah, don't let the academic bureaucracy slow you down.
Oh.
They have no business doing that to young physicians. It drives me insane. I was the object of it in 1986. Here you are, it's the same shit going on now in 2022. It's ridiculous.
Yeah. I think it's calmed down a little bit though, right? Like
she's saying she's facing the exact same stuff I did. It's just the same damn thing. And
I mean, it seems like
I had to really, one of the rereasons I didn't use my real name and stuff. I just didn't want anybody to know. I didn't want any hassles.
Right.
I didn't want
Well,
anybody to know
you stopped doing radio for a while, but you flew under the radar sometimes.
Eventually, I went back because we had guys like Fauci at.
Did people call you David before you? Okay. Oh.
No. I just never used Dr. Pinsky. I just didn't. I just invented Dr. Drew to kind of hide myself. And Fauci was saying, you got to get out there. You got to get out there. He kept saying there are going to be 2 million dead. He is prone to excess. He is prone to excess, but he's also got good judgment. He was just kept saying there are going to be 2 million dead if you guys don't get out there and change people's behavior. Mm-hmm. What I find extraordinary, one of the other extraordinary things about this outbreak was we learned how to change people's behavior. We learned how to adjust sexual behaviors, the most difficult thing in the world to get people to do. We learned how to get them to wear condoms. We learned and that was all abandoned during COVID.
If we had social media during HIV, it would have made a huge difference too.
Well, yes, it would have, because by the time when I got on the radio in 1984, young people had not heard of AIDS.
Yeah.
They'd never heard of it, and I was
until
stunned.
Loveline.
I was stunned, and that was 3 years into the pandemic at that point. And to be fair, we did not have terms like safe sex. We had not yet isolated a causative agent. We were just starting to talk about HTLV-3 at the time. Mm-hmm. Human T lymphotrophic virus, we called it before we called it HIV. And it was a challenging chapter, and we learned how to change behavior. And it's through narrative and humor, all the stuff you're doing, Tiffany. Humor, narratives, cajoling. You know how to get people to change their behavior. You don't come at them, because you come at them, you get a force screen, mm-hmm. and then
especially kids.
Force shields go up. I mean, especially addicts. That's all I deal with all the time, is trying to get people to come along to help change. You don't do frontal assault. That never works. It doesn't change health behavior. You need narrative, you need music, you need humor, you need relatable sources. Mm-hmm. And then people go, oh, okay, I get it. Okay, thank you. And off they go as adults, making their own choices, which is what I thought we were in this country. And evidently we have to be led around, both physicians and otherwise now. So that's my public service announcement.
I hope it goes back the other way for physicians.
I hope so. It's going to be people like Tiffany that fight it off. And I'm too tired. What's that, Caleb?
I think we should mention too. I've read a study before that said that after 16 and pregnant and teen mom came out, that it led to a 5.7% reduction in teen births. So media actually does enormous effects.
Oh, look, when they came to me about teen mom, I just said, that's going to work. That is going to reduce teen pregnancy. I know it. Now, not only did teen pregnancy start to drop, the very quarter that we started airing 16 and pregnant, but they've done 2 academic studies where it's very simple studies. They went into communities and they associated high viewership, like the higher the viewership, the lower the pregnancy rate. That is 2 academic studies published on that.
That's why you still have a job there.
And what did they do? They just let young people look at the consequences of choices. Relatable sources, young people like themselves, living their lives. Oh, this is what happens?
Education.
Okay, got it. As opposed to Tiffany or I wearing our white coat or your scrubs, telling them how it's going to go, that doesn't go anywhere. Mm-hmm. That does not change behavior. We know that. We've known it for years. And yet in this pandemic, I don't know, we decided we had to be authoritarian or something. But anyway.
Yeah.
So Tiffany, sorry, you're motivating me to go off on my soapbox a little bit, and I apologize, but it's been a privilege to have you. In addition to your anesthesia and your candles and your stand-up, do you have any other sort of wish list for the future, things we can look for?
I have so many goals. I would love to write a book about my life immigrating to America and all the challenges that I faced. I've already written a children's book that I'm trying to get published, the proceeds of which will be given back to the underserved community to build libraries. And I have so many things in my life that I want to achieve. So I'm just getting started.
Good
Great.
for you.
Keep it going. And then when you guys get your condo in Pasadena, you'll let us show you around here. So, okay, well.
She might want to have oceanfront in Malibu.
Okay. We can't give you that. But Susan will show you around Orange County, nevertheless. Let me really quickly look at the restream here, see if anybody has anything else for us before I let Tiffany go. All right, we're going to wrap this thing up. Tiffany, thank you again. Tiffany
Michelle
Moon,
is a huge fan. Thank you for
Michelle Poe, who booked you. She's a big Dallas Housewives fan, and she
sorry it had to go, but
had only positive things to say about Tiffany, so that was good. And you survived it. So we'll see you soon. I hope it's TiffanyMoonMD.com. Barely. That's really funny.
Yeah, it's a tough role. I got invited to Beverly Hills and we had to pass.
We didn't look into it. All right, we're going to wrap this thing up. We will see you on Tuesday, Susan. Is that correct? I know we have Dr. Kelly Victory coming in on Wednesday. I'm not sure we have our...
Maybe Monday. Well, I don't know.
All right, so early next week, same time, 3 o'clock Pacific, and that's on Wednesday. And thank you all for being here on the Clubhouse.
I think we're doing Monday, Tuesday, Wednesday, Thursday next week.
Yes, and we're going to end the Clubhouse. And thank you all for being here. Thank you, Caleb. Thank you, Susan. Thank you, Tiffany. And we will thank you, Michelle.
That bobblehead, everybody.
Where do they get it?
drdrew.com/shop.
All right, we'll see you next week. There it is. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.
I got a question for you, Drew.
Yeah.
So once every other week, you call me Nadav for like hours.
I do?
And a lot of times. You'll
really?
just do it. And it's like, I get it. You know, like I do similar shit all the time where you just forget. It's whatever.
Okay.
But how the fuck do you remember cycloglanginal before
how do I remember
fucking nerves? How do you remember all that shit?
Yeah.
Like it's nothing.
It is. That's actually a good question.